Welcome back to MTP number 12. I'm sorry we've been off for about a week. I was out in Las Vegas with the aesthetics group working on some length and girth things at their convention, amazing convention. I mean, they've really made some advances to that group. Apparently it's been sold a couple of times, and Michael Moretti, who did a great job before, now I guess it's moved on to a bigger company, and the show was bigger and better than ever. Not that it wasn't wonderful before. So this week, and I've been sort of skipping this question, not intentionally, but it's come up a couple times. This is Joelle, who's asking about pain after penile implantation. I can tell you that the research group that I work with, we've done a lot of work on managing pain immediately post-op and trying to keep our patients away from narcotics, which is the move for most surgeons these days, is to not use any narcotics, narcotic-free penile implantation, sorry. Also we don't have any guests because I just got back in town. So narcotic-free, that is our goal, is to have a narcotic-free inflatable penile prosthesis. There's certain things that most of us high-volume implanters do, and we have published on this, and it's using some longer-acting injectables to inject the nerves, the nerves that innervate the penis, the scrotum, and the abdominal wall. We like to use what's called a pudendal block, a dorsal nerve block, and a fan block in order to gain complete access to a patient without any other modality of anesthesia. And these injectables have been found to last quite a long time, 10 hours, 14 hours, and these are not expensive. There's some expensive products out there that seem to not be as efficacious, at least in our studies. They have shown pretty much similar efficacy. So we've also been able to keep the cost of this procedure down. Most of our patients are on anti-inflammatories post-operatively. We may use a non-narcotic narcotic like tramadol for a day or two just so you can forget about your pain. Now, let's look at the real numbers. About 80% of guys say, hey, it wasn't bad. It wasn't bad at all. But there's no doubt in our practice, 20% of guys will tell you it was bad. Now I'm going to share some personal information. I actually had some scrotal surgery not long ago, and I know what they mean. Testicular pain is bad, and there's all kinds of home remedies that we use to help. Hot water followed by ice is very soothing. Oftentimes we'll use a pure A&D ointment for the scrotal skin to get that burning sensation away. I have to give you an anecdote that will make you understand that 20%, a few months down the road are extremely happy. I had two brothers. One of the brothers was a physician, and I did his implant probably 8-10 years ago. And he, I guess, had not shared it with his brother. He was an out-of-towner. His brother comes to see me 8 to 10 years later, and he gets his implant, and during that first week he's like, oh my God, why did my brother not tell me about this pain? And so he called his brother in front of me, and his brother said, look, once I started having sex, I forgot about the pain. So some realistic numbers in the hands of high volume implanters. More than likely it's similar to what we see. 80% are pretty good with just anti-inflammatories, maybe a day of a non-narcotic narcotic. Hopefully whatever surgeon you choose will use a local block that can really help you during that first evening. We do not leave the implants inflated. A lot of guys do. I find that that's a lot more painful. We don't use a Foley catheter. That can cause some pain. So we really do try to minimize it, but I'm not going to sugarcoat it. 80% are great. 20% I kind of know because I went through it. But we're there for you. And remember the anecdote about the brother that said, I completely forgot about the pain the first time that I had sex. So that being said, if there's anything else that you want to know about post-operative pain, please send it in to, what is it? What's our?
Perito.
peritourology.com, and there'll be an area where you can submit your questions for MTP. So this has been Meet the Penis. Have a wonderful week, and we will see you next week, I promise. And we have a good crew coming. Bye.